When we talk about what constitutes the normal period, there are a few parameters we look at. Number one, we look at the regularity of the cycles, whether it occurs on a regular monthly basis. We also look at the duration of the flow. So the normal duration of the flow is normally between 4 to 8 days. We also look at how heavy the flow is, for example, whether it's associated with any heavy flow such as clots. A normal period can be in terms of when it becomes irregular. So if a patient has only like one menses every 3 to 4 months, that is also considered to be abnormal. Abnormality can also be when the flow is very heavy, for example. If the flow is heavy and is associated with the passage of clots, to the extent that the patient needs to change the pad every few hours, then that is considered abnormal. So some patients even experience giddiness and disease spells when the flow is very, very heavy. Abnormality can also mean if there is irregular bleeding. So for example, they are spotting or they are bleeding in between the menses, every few days. That is also another abnormal sign. And yet another abnormal sign would be when the patient has got very painful menses to the extent that it affects the quality of life and she has got to lie down in bed or take painkillers. So for irregular cycles, we may have to look at whether the patient is ovulating regularly or not. Some of the causes of irregular so-called menses can be polycystic ovaries, which causes the ovaries to have delayed ovulation from time to time. Stress is another factor. If the patient is very stressed out, then like for example during exam time or due to work stress, sometimes this may cause a delay in the menses as well. For heavy flow, we have to look out for things like fibroids or myomas, and also the presence of conditions such as endometriosis or adenomyosis. And sometimes even polyps can cause heavy flow. For irregular bleeding, for example, then it's important to look at the cervix to make sure that a pap smear has been done. It is also important then to look out for any endometrial polyps within the uterine lining as well. So the first step in diagnosing an abnormal period will be to take a good history. Once we establish that there is an abnormal period, then we will go on to investigate the patient. This may take the form of a pelvic examination, a pap smear, and an ultrasound examination as well. So depending on what we find, the ultrasound may reveal things like fibroids or polyps, and then we will actually go on to suggest what may be the necessary treatment. So although abnormal periods are not uncommon, it is important to seek attention earlier so that at least we can make a diagnosis and then institute treatment as soon as possible.